Statistics from the National AIDS and STI Control Program indicate that about 54,310 people in Mombasa County are living with the HIV virus. Out of those, about 15,000 adolescents and youth aged between the ages of 10 and 24 years are living with the virus. In 2015, about 280 youth and adolescents lost their lives to HIV-related illnesses. Now, this is the same group that is contributing to the highest new HIV infections nationally. Hence the question, what are the contributing factors?
They die because of the stigma. The stigma that starts from itself. They fear people talking about them. People knew that I was positive in my area where I stay in Congo, where they say calling me a lot of names. Huyu ni malaya, lena wanaume apate pesa. So I was so down. Yeah, I think my medication, but through my area, the society, there were a lot of problems stigmatizing me. So it was so bad. Even going to people's birthday was hard because they know not to birthday. They catch you like this, I'm going to infect you.
What is supposed to be a normal phase in their young lives has now become a complex web of deceit and emotional turbulence, thanks to the stigma attached to the virus they carry. Even with life-saving drugs available to them, stigma is the one barrier they must conquer.
People knew that I was positive. They came to talk to my boyfriend and share with him. Winnie is a good person, he's a prostitute. He just sleep with men to get money to pay their school fees. So he came to a place arguing with me. I wanted to know how and why ukuniambia ukuna ugonjwa ya ukimwi. There you look, you're so healthy, you're very beautiful. What happened? Tell me what happened. Tell me what happened so that you have this virus at this time. Then I shared my story with him. He gave me the support. If I asked for forgiveness, give me the support to live.
Since December mpaka sahi, we've had so many cases of adolescents who have died due to non-adherence to medication. Non-adherence in a way that they go for a drug holiday. Those who are in school, most of those who are in boarding, akienda shule anaona hii burden ya kukaa na drugs hapa na wenzangu wananiona watanishuku vibaya, so anaona let me just stop taking my medicine for the 3 months, then nikirudi tena I'll start again.
A startling fact that continues to baffle even those who have been in the forefront in the fight against HIV.
Kuna wakati mimi nimeacha dawa. Nikaona nimechoka, afadhali pia iwe venye inatakikana iwe. Manake kumeza dawa kila siku, asubuhi, jioni, utakuwa unaambia marafiki samani naondoka naenda nyumbani. Kwa nini unaenda nyumbani? Hawataki kuelewa, hutaki kueleza kwamba unaenda kumeza dawa, na wakijua pia ndo hawa wanakutenga.
Have you ever defaulted?
When I was in high school, the reason being I don't want to be seen taking medication. And again, I'm like thinking, what will the teachers maybe say? What will my friends think about me?
This girl, whom we shall call Betty, says hers has been a journey of hits and misses.
Nikaanza kukua mgonjwa, ndo hapo nikaona bado tutarudisha watu kujua labda yule kweli ameathirika. Alafu pia nikachukua ile nilipoona role models kina Asunta na wengine wenye wamejitokeza, nikasema kama yeye ameishi, mimi ni nani nikate tamaa saizi. Ndio nikachukua jukumu la kuendeleza kumeza dawa, na sasa pia mimi naimiza wenzangu wasiache dawa.
The statistics point to a deeper problem. In 2015, there were about 270,000 of them living with HIV in the country. They are the group that is driving new infections nationally, with an estimated 36,000 new infections in 2015, according to the National AIDS Control Council Progress Report.
We know that according to demographic and health survey, a child, let me use the one, a child, before he or she reaches the age of 15 years as and the first sexual contact. And most likely 60% chance he or she has not used protection.
So when you have sex that early, when you indulge in sexual activity that early, it will often be non-consensual, it will often be without protection, it will often be in a vulnerable and abused state. So then new infections are likely to happen at that stage.
These people, the adolescents who are living HIV/AIDS, are really not getting treatment as easy as the adults because of the stigma related with HIV/AIDS. So if you look at the treatment coverage, what we call antiretroviral coverage for adolescents is quite low. It is like 30% when our adult coverage is 70%. So our youth, our children, our adolescents and young persons are not getting treatment.
They point out some of the challenges in accessing youth-friendly facilities.
Hiyo kukua judgmental, alafu katika hizi huduma zikuwe more youth friendly, zikuwe mingi youth friendly services. Manake unapata kama ni mimi kijana niende katika hospitali nipate ni mama mzee, sitapata ile nafasi ya kusema chenye kinaniumiza rohoni. Manake labda nikiongea nitakuwa judge like wewe bado ni mtoto, mbona hizi vitu zote unataka kufanya?
Nifuatilie hapo. Ni jambo huwa linatokea au
ni jambo linatokea. Manake mimi kama mimi kabisa kwa kujitumia kama mfano. Kuna wakati nimeenda kwa zahanati. Manake sio nilikuwa nataka kujua mbinu za kupanga uzazi. Nilipoenda hapo nikaamba wewe ni msichana mdogo, alafu furthermore umeathirika. So unataka kupanga uzazi wa kazi gani?
And sexual activity is the leading cause of HIV infections, and therefore it means that our countries we need to tackle that aspect. We need to talk to our kids and our adolescents a lot at an earlier stage about sex and to openly have that dialogue.
As National Youth Control Council, as the county, and as health, HIV/AIDS fraternities, to ensure that we are establishing adolescent-friendly desks, or what we are calling youth-friendly services centers in every health facility. We know that it's easier for a peer, an adolescent peer, what we call peer-to-peer counseling, peer-to-peer guide. It's easier for an adolescent to talk to his peer. So, as government, this is one of the areas that we are facing. And if you look at the Mombasa County Strategic Plan, HIV/AIDS Strategic Plan, that is one of the interventions that is proposed so strongly and actually even costed for the next 4 years.
The hope now is in ensuring that the new programs that target the youth are friendly enough to motivate them to access the services they desperately need.